Well, it's clear by the people sitting around the table that this is a national problem. I have a particular interest in this issue of patients with IBD accessing urgent care using the emergency room when other alternatives might be not only better for them, but less expensive way of delivering care. So this is a national problem. It's ongoing in every jurisdiction. I think that while there's different provincial health systems, there's really one model in Canada, and I think we share the same problems. So that was very clear today. I think the other thing that came through is that physicians alone are not going to be able to change a model of care and deliver the care that's needed for patients with IBD as patients with other chronic diseases as well. And so that we're going to have to expand our model to ensure that there are other healthcare providers, clinical psychologists, nurse practitioners, perhaps nurse navigators, that are going to help both patients and physicians ensure that patients are getting the care that they need. And I think that was a very clear point. I know that governments are interested in expanding different care providers, and we need to be interested in incorporating them. I think we are. There is going to be a need for some costs to change the model up front, but hopefully that will balance out by reducing the costs at the other end because we're providing better care and patients aren't using expensive resources like the emergency department. Well, I think that everyone here needs to meet with, or attempt to meet. It's not so easy when you say you want to meet with your provincial representatives, your provincial health providers, your provincial governments. You can ask to meet. It doesn't necessarily mean that you will meet. But I think that we need to go back to our respective provinces, and each province is probably in some way, altering, tweaking their healthcare system. Where I am right now in Winnipeg, we're undergoing a major overhaul. It's called Shared Health, and they're really trying to change the model of delivering care across the province. So it also provides me an opportunity to tap into a time of change. But I'm hoping that everyone will go back to their respective provinces and try to meet with people who are the healthcare planners and encourage them about how IBD can serve as a model to providing a broader care, a more comprehensive care before patients get really ill so that they have other means to access. And it's not necessarily the overburdened, complex area of the emergency department.